Reduce neck and shoulder strain while breastfeeding. Hi, welcome to our Ed Talks, little snippets of education to help you heal and feel empowered. I'm Justine Calderwood, pelvic floor physical therapist and certified birth healing practitioner. Okay, breastfeeding mamas, let's talk about how you can reduce a lot of this neck and shoulder strain and tension that you feel because you are breastfeeding and you're holding baby and you just feel like you're starting to feel that maybe headaches or all of the strain into your upper body. So I would like to give you some tips on how to reduce that. My first tip is make sure that you have plenty of support. I see a lot of moms that just get in a hurry and they're like, I can just feed baby while I'm walking around or just while I'm sitting here, and they have no support. So I really encourage you to get a good supportive breastfeeding pillow that you can use for support, and maybe even an extra pillow if you need it. The key here is to bring baby to breast instead of bringing your breast down to baby. So if you are breastfeeding and you just feel like you are kind of hunched over and you are trying to accommodate and come to baby, you want to make sure that you're more of an upright position when you're sitting and that you are going to bring baby up to you. So you may need, besides the breastfeeding pillow, you might even need maybe a throw pillow or another pillow or even like a folded up towel so you can get baby in a good position regardless of the type of hold that you are using for supporting baby during breastfeeding. Another thing to consider is even just your chair support. So you want to have more of a firm chair versus a really soft couch where you're just going to kind of sink into that. And you want to try to have your feet on the floor. And like I said, maybe you're more upright, but it may help also to be more reclined so that you're back a little bit further here so that you're not, again, coming forward. And if you need to use a pillow, say behind your back for a little support, that is always an option as well. So really pay attention to your own posture, how your body feels, and see if you can't use some other props like that to accommodate and support yourself. Another position that you might breastfeed in is sideline. So let's talk about how you might be able to support yourself a little bit better here. So I'm going to go ahead and lie down onto my side, and you would be then breastfeeding from the side of the body that is closest to baby. So you bring baby here, but depending on the size of your breast, the size of your body, size of baby, this might not be very supportive. Baby might be farther away from you, and you might feel inclined to have to lean in or roll over slightly in order to meet up with baby. So again, we want to bring baby to breast instead of breast to baby. So using something like maybe a towel roll or a small pillow to place underneath baby to bring them up if need be. And ideally, you want to have baby in line here as well as your own body. So placing a pillow between your knees if needed, maybe some support behind your back. But you do want to be supported when you are taking care of baby. My next tip is a stretch to do for your chest and your shoulders and even the front of your neck in order to relieve some of that tension and strain. So you could take a towel, and I like to just roll this up so that you have a nice long towel roll. And you can place this on the floor or on your bed. And I will say here, you could use a foam roller instead, but I like this because it's nice and soft. So what you're going to do is you're going to sit on the end of the towel, and then that's going to be right along your back. And then what you can do is take your hands, palms up, and come out into a T position like this. And this is a really great way to get into the front of the neck, across the shoulders and chest in order to relieve some of that tightness. So I would spend 3 to 5 minutes here in this T position, and then you can slide your arms up a little bit higher so that you're in a Y position, and that gets up underneath this breast tissue and the pec muscles. So give that a try as well, and I would recommend do that daily. My last tip is using a little inflatable ball to do a myofascial release for your shoulders and chest. So with that, I recommend lying down onto your bed. So you would take this ball, it's pretty spongy, it's got some give to it, but you're going to lie down onto your stomach right at the edge of your bed. You're going to take this ball and place it up into the front of your shoulder, and then you're going to lie down so that's positioned right into that area, and you can let the arm hang down. So to do a myofascial release stretch, you would hold this for 3 to 5 minutes, allowing that area to soften and let go. Let me show you a variation of this as well. Another variation of that same release is, instead of lying down onto your bed, you can use a doorway. So you can take the ball here, and you're going to work both sides, but you can place it into the front of your shoulder here, and then just come into the edge of that doorway. And right now my right arm is on the wall. I'm just going to move over here so you can see, just have my right arm on the wall beyond what you can see. And you can play with that a little bit where you're out into like a T position or up into that Y position again. And you want to lean into the wall and allow that ball to soften into the area. Again, hold for 3 to 5 minutes to get a myofascial release. If you are a breastfeeding mom that is struggling with some neck or shoulder strain, discomfort, and it's really not going away, and you give these tips a try, reach out to us here at the Healing Spot. We would happy to give you a hand, to help you out, to give you more tips, and also to help you feel better so that you can enjoy being the excellent mom that you are. You can head to our website, healingspotpt.com, and pick whatever choice, pick whatever option works out the best for you. We do work with people one-on-one, but we also have our Fit to Be classes where you can learn some really great ways to get back into exercise and work on your posture and breathing, which can help a lot with tension and pain in your body. Thanks for watching this Ed Talk, and I'll see you on the next one.